Welcome to the Oklahoma Low Back Pain Today, patient-centered education podcast. This podcast is a production of the Spine and Joint Treatment Specialists at Elite Pain and Health, a leading independent Oklahoma spine and joint specialist treatment clinic. This episode is produced and directed by Dr. Keely John Booth, MD, and provides valuable insights for patients wanting to learn more about lumbar or low back pain. All information is for educational purposes only and should not be used in place of an evaluation with an experienced licensed medical professional. You can reach out to Elite Pain and Health at epainhealth.com or call 405-444-7246 for more information. Okay, let's jump right in and unpack something that I guarantee a huge chunk of our listeners deal with. Mm-hmm. I mean, whether you're working long shifts out in the oil fields or sitting in a truck cab all day or, just work in the farm, you probably felt that shooting pain.
That specific pain, yeah.
We are talking about sciatica.
It really is practically an occupational hazard around here. The numbers are pretty staggering. Up to 40% of people will experience it at some point.
40%? That's almost half.
It is. But, the interesting thing is how people talk about it. We hear them say, oh, I caught a case of sciatica.
Right, like it's a flu bug or something you can catch.
Exactly. But when we actually look at the anatomy, it's not a disease at all, is it?
No, not at all. It's more like a warning light on your dashboard. It's a symptom.
That's a great way to put it.
And the way the notes described it really clicked for me, the garden hose analogy.
Oh, yeah, that one's perfect.
So you have the sciatic nerve, and it's massive, right?
Yeah.
The biggest one in the body.
The biggest one, yeah. It runs from your lower back, L4 to S3, all the way down.
And it's acting like a hose that's supposed to be carrying water.
Right, carrying all those electrical signals from your spine down to your feet.
And then something steps on the hose, flow gets all messed up.
Yeah.
And usually the thing doing the stepping is one of those spinal discs.
Mm-hmm. The jelly donuts.
The jelly donuts of the spine. I love that.
It's just a perfect visual, isn't it? You have that tough, fibrous outer layer and then that soft gel-like center.
Right.
And if that disc herniates, which just means that jelly center pushes out, it can press directly on that nerve root.
So that's the foot on the garden hose.
That is the foot on the hose. And that's where you get that very specific sensation. It's not just a dull ache.
No, it's electric. That's the word patients use, right?
That is the hallmark. It's a shooting, burning pain. Sometimes people literally say it's like an electric shock traveling all the way down, maybe even to the foot.
And you can get numbness too, or that pins and needles feeling.
Pins and needles, weakness.
Yeah.
Sometimes something we call foot drop, where you actually can't lift the front of your foot properly.
Okay, so here's the part that really blew my mind. When my back hurts like that, my first instinct, my only instinct, is to lie down and not move.
It feels completely counterintuitive, doesn't it?
Totally. But the data says that's actually the worst thing you could do.
It is. That idea of prolonged bed rest it's a total myth. It can actually make you stiffer and make the pain worse in the long run. To heal, you have to move.
So instead of just parking it in the recliner for a week, you should gently walking?
Gently, yes. Safe, low-impact movement is key. Walking is great. Swimming is fantastic. You're just trying to keep things mobile and help flush out some of that inflammation.
Okay. But before we get too far into fixing it, we have to talk about the red flags, the danger zone.
Yes, this is critical.
There's a set of symptoms where it's not, I should call the clinic tomorrow. It's, I need to go to the ER right now.
This is a true medical emergency.
Yeah.
If you suddenly lose control of your bladder or your bowels,
okay,
or if you go numb in what we call the saddle area, so your inner thighs, the groin area,
right,
that's a sign of something called cauda equina syndrome. And if you don't get that pressure off the nerves immediately, you could be looking at permanent damage. That's a 911 call.
That is terrifying, but so important for people to know. Okay, so assuming it's not an emergency and I go see a specialist, how do they actually see the problem? An X-ray won't show a jelly donut, will it?
No, you're right. X-rays are great for bones. To see the soft tissues, the discs, the nerves, the gold standard is an MRI, a magnetic resonance imaging scan.
And that uses magnets to get a clear picture.
Exactly. Magnets and radio waves. It gives us a precise map of exactly where that disc is pressing on the nerve.
So once you see the problem, the conversation turns to treatment. And I think we said surgery is way down the list.
Way down the list. We always start with conservative care. We mentioned staying active. Physical therapy is huge.
What do they do in physical therapy for this?
A lot of core strengthening and specific exercises like nerve gliding, which basically helps that sciatic nerve move more freely again. Plus, you might use an over-the-counter anti-inflammatory like ibuprofen or heat and ice.
And if that's not enough, there's an intermediate step, right? Before surgery, the epidural steroid injection.
Exactly. You can think of it like a precision strike. Using X-ray guidance for safety and accuracy, a specialist can place a powerful anti-inflammatory medication right at the source of the problem.
So right on that irritated nerve root.
Right where the fire is, it calms that inflammation down so your body can heal and you can get back to your physical therapy and your life.
And surgery, like a microdiscectomy. When does that come into play?
Really, only if the pain is just intractable and nothing else works, or if you have that progressive weakness we talked about, like the foot drop getting worse. It's effective, but for most people, it's just not necessary.
That's so reassuring to hear. The takeaway seems to be that movement is key, and you don't have to just live with it.
You absolutely do not.
We hope this episode helped you understand sciatica. If you're experiencing these symptoms, you don't have to live with pain. The specialists at Elite Pain and Health are here to help. Visit epainhealth.com or call 405-444-7246. Thank you for listening to Oklahoma Low Back Pain Today. Take care of your spine, Oklahoma. We'll see you next time.